law enforcement and higher education. So we've had the opportunity to really comb the field to see who would be best to speak from those entities. And we're partnering with the Higher Ed Center to bring in Dr. James Lang. He's with San Diego State University, and he's going to talk about adapting prevention strategies related to legalizing or marijuana's legalization and how our strategies for that, particularly related to college campuses, need to change and morph due to the impacts that we're seeing. We'll also have Monty Stiles, who will talk about marijuana's impact on law enforcement, and Tom Gorman is the director of Rocky Mountain HIDA, and Rocky Mountain HIDA is based in Colorado, and he's really going to speak about what they're seeing in Colorado now that it's legalized there both medicinally and recreationally, and really talking about some of the trends that we're seeing. One of the things that came out of the Rocky Mountain HIDA report is that overall traffic fatalities in Colorado have decreased, which the pro folks have really leaned into to say, hey, look at this, traffic fatalities have decreased now that marijuana is legalized. But the truth of the matter is when we're looking at traffic fatalities where substances are involved, including marijuana, those have increased exponentially. So we really want to focus on those details and make sure that we have the appropriate knowledge and we're able to speak to folks in important and appropriate ways. For April 1st, we have Dr. Kevin Gray, and when you're looking at the impact of marijuana on the brain, that will be his focus. He speaks from two sides. There's the lizard brain and the wizard brain, and that's how he kind of breaks it apart. And for the lizard brain, that is your basic functioning like breathing, walking, things like that, that marijuana doesn't really affect that greatly. Where marijuana is most impactful is what he calls the wizard brain, which is more of your executive functioning in areas that's going to have longer impact, and it's not necessarily so easy to see. So we'll talk about that. And then we'll have Bob Doyle, also from Colorado, who's going to talk about commercialization. And Bob's work began within the tobacco and studying tobacco commercialization, marketing, etc. And we can see a lot of commonalities between the promotion and commercialization of tobacco and what we're seeing with the promotion and commercialization of marijuana. And then for the April 2nd plenaries, we've got Amy Ronshausen. She's in Florida, and we'll talk about their state efforts. They were successful in defeating legalizing marijuana within the state in the last ballot initiative. Some of the challenges that they did have is that fortunately, the way their law is written for their statewide constitution, they had to have a 2/3 majority to make changes to the Constitution. And they had the majority of voters voted in favor of changing the law, but fortunately they didn't get to that 2/3 majority to be able to change it. So she'll talk about some of the work that she's done there and some of the challenges they've had. And then Sue Thaw with CADCO will be talking about messaging and ways that you can take the information that you learned at the conference and take that back to your communities and provide that community change. Tony, are you with us?
Yes.
Excellent. And we will just turn things over to you.
Oh, thank you. In a truck stop somewhere on State Route 60 in wherever, I don't even know what county I'm in right now. But thank you so much for giving us that overview of MAP. That should be a really, what we wanted to do, and I guess one of the things that I feel somewhat defeated about when I go and speak at these things across the country, and I stay for usually the majority of the conference, is it's information, and we want to have more of an attitude of action as well. So what are those pieces? So as Derek explained, we kind of have the college and law enforcement, how that's going to hit those two sectors of the community on the March 31st. And then the first is a day of science. And it's a day of looking at it from a scientific view, also from a marketing view. And then finally, the last day is, how do we do this? I will go back to the two questions that I've said a couple of times now. That had a conversation with Secretary of State John Husted, and he said the two questions that we have to ask is, is this right for our state? And if so, what is this going to look like? What should it look like? So, our view is this isn't right for Ohio, especially the ballot initiative, which I'll get into a little bit later. This is not the right thing for Ohio. But if it would happen, what are some of those concerns that other states are trying to figure out? What are some of those pieces that sectors of the community that don't really have a handle on, marijuana legalization, and well, it's not going to affect me, so they don't take a stand on it? What are some of those messages that might be able to help individuals with that? So, and also, it seems like there's a lot of the same types of speakers that we have at many of these conferences. And I wanted to go, we at Drug-Free Action Alliance wanted to go a little bit where it's new information. It's maybe someone you haven't heard before. And, I've heard many of these folks and fantastic speakers. Tom Gorman with the HIDA report. I mean, he does the Rocky Mountain HIDA report. It's a 100 and some odd page document just talking about legalization impacts and what they're seeing in that state. Monty Stiles, phenomenal speaker. Once you hear him, you really will be thankful that you did. He was a fantastic speaker. Dr. Gray, again, phenomenal speaker. So with new information I had not heard before, especially in regards to mental health and the health of teenagers, as far as the mental health of teenagers and what studies are beginning to show. So if you're coming to the conference, also make sure that maybe you bring a decision maker with you. Look at the days. What would they like to hear? What is it that might be something that would be of interest to them? So please, bring someone with you, and because this is going to hit, and it's going to hit hard in Ohio. First off, though, with our webinar, wanted to get with the State House update. We have some bills that have been dropped. First was the Ohio budget bill, where Governor Kasich has not unveiled the language, but unveiled some pieces that he feels are priorities. Some of those that might be of interest to us. He's urging that the General Assembly pass a dollar tax on tobacco products to be used for different things around the state. We know in research that the higher a price is, the less likely people are to use that product. So when you add a dollar a pack price to tax to the price, then hopefully that will encourage some folks to stop smoking, just for the simple reason of economics. Another piece is we have heard that there's going to be another $1.5 million for prevention. I don't know what exactly that would look like. I don't know if it's Start Talking. I don't know if it's something like that. But we have heard that the continued support of prevention is in the budget. Also talked to Representative Sprague, who is also in support of funding for prevention around the state. He has been a champion for us, and we have some other meetings that we're going to be lining up to proclaim the worth of prevention and actually the cost savings that it can have over the long haul. Some other bills that were introduced. House Bill 4 was introduced by Representative Sprague, and it's the overdose drugs bill. Basically what that is it expands naloxone access to individuals, family members who have loved ones who have some, an opioid addiction. And for those of you who might not know, naloxone it's a drug, it's a nose spray that if a person is in overdose, is from opioids. They spray this up their nose, and it can keep them from overdosing and dying from opioids. You need to get them to the hospital right after. It isn't a cure-all, but what it does is it buys some time and gives a person who is in an overdose situation some time to get to a hospital or some kind of medical facility to save his or her life. So that is one bill that is going through right now to the General Assembly. Last week, as we were talking to Sue Thaw at CACTA, one of the concerns, it does have to do with naloxone, and this isn't a federal budget bill. This is not the state budget bill. So this is Congress and the President and all of that. They actually have in their prevention, in the block grant that many of us receive funding from the federal government through the state, they actually had $12 million set aside for naloxone. Not quite, I guess, if you want to take the word prevention, and this is death prevention, naloxone, but we would like to see that naloxone not taken out of prevention funds, but perhaps treatment, recovery, or $12 million to the federal government is like 25 cents to you or I. So can it be taken out of another? Can it be taken out of another fund? I wouldn't get too worried about this. I was in a meeting yesterday, and I don't think they have passed a budget at the federal level for something like 13 years or something. It's been forever. So as the person who said, yes, the federal budget was delivered, the President's budget, and it was dead on arrival. So we would continue to monitor this to make sure that prevention funds are actually used for evidence-based prevention at the federal level, and not not for things that I guess prevention could be in the name, but it's not evidence-based practice, evidence-based prevention for communities. So, House Bill 4, we're actually in favor of to allow folks to get naloxone. The federal budget, that piece with the $12 million for naloxone, we are obviously not. House Bill 14 was also introduced. It's powdered alcohol. It nearly was passed last year, but got stalled in the Senate before the lame duck came to an end. They have reintroduced the same bill. The same two gentlemen, Representative Gurberry and Representative Beakey, have taken that back up, and it's again the same bill, trying to ban powdered alcohol. Powdered alcohol is kind of the Kool-Aid of alcohol. It's literally just like the title sounds. It's powdered. You pour it in a glass of water or a bottle of water, and it creates an alcoholic beverage. So we are very much not in favor of powdered alcohol being legal in Ohio. They have not passed labeling laws at the federal level yet, but we want to get out in front of this and get this banned before it's legalized here in the United States. House Bill 28 is from Marlene Anielski. She is a woman from Northeast Ohio. Her son committed suicide, and she is very big on suicide prevention, and introduced a bill specifically for institutions of higher education. They would have to have some kind of suicide prevention program or curriculum or something like that on their campus. So that's what House Bill 28 is about. House Bill 33 is another bill. It's the medical cannabis bill. It is not medical marijuana as you would think of, adults getting it. This is strictly for children with seizures. With seizure disorders, and basically it's the Charlotte's Web oil that I've spoken about before. And basically, we're not so far against getting these children the medicine they need. However, there's as we feel, a better alternative, something called Epidiolex, which is actually going through kind of human testing right now in other states, and we would encourage that. That if it is going to be a medicine, and this works about 54% of the time, it's Epidiolex, then let's go through the FDA process. Let's see what the long and short-term effects are. Let's make sure that they have the correct dosages and those types of things, so there isn't damage done on a long-term basis or even a short-term basis. We really don't know what this does. We know that on about half the kids it does help with seizure disorders, but we don't know what else it does to other systems of the body, what it does to long-term use of this stuff. It's literally an oil that you drop on a kid, on the child's tongue. So this is something we want to meet with Representative Rutherford, who's the sponsor of the bill. He's a Republican from the Cincinnati area, I do believe. And also, House Bill 37 is alcohol possession. Again, they're trying to incorporate more of the take away the open container laws that are around some kind of markets or something. So that was just introduced, and we're looking at that now. So to go to the next slide, the marijuana update. Seems like I do this every time, and I think I probably do. Responsible Ohio has dropped their language. So they have actually given their amendment language. We're going to post it on our website tomorrow. And what they have done in the last couple of weeks, they have been given us the names of the 10 investors. And those should be listed on your screen there. Rick Kirk is a gentleman from Central Ohio who owns something called Hallmark Campus Communities. It's a lot of apartment places and those types of things around college campuses, which is interesting. Oscar Robertson is the basketball player who has said that he had prostate cancer, I believe, and has been has used that and sees the medical value of marijuana. Nanette Lepore is a fashion designer from Youngstown. Barbara Gould is a fashion designer and also in the arts community in Cincinnati. Frosty Rucker is a very large fellow. He's a defensive tackle from the Arizona Cardinals football team. Frank Woods is CEO of Secret Communications, who must be leading up their campaign because it's been quite secretive until now. Sir Alan Mooney is on the board of the Ohio Council of Churches, and he has earned his money a variety of ways, and was actually knighted by not this Pope we have now, but the Pope before, who I can't remember, in this parking lot of a truck stop. William Foster owns A1 Quality Logistical Solutions. William Cheney Pruitt is DMP Investments. John Humphreys, DMP Investments. And Bobby George is another financial advisor at the Corporate Management Group. Basically what has happened is they have already contributed to their campaign fund $1.7 million, a little bit over that, and they would own all of the marijuana market in the state of Ohio. It literally is a monopoly. We, in our statements that hopefully you're seeing and getting, are calling them a cartel. That's exactly what it is. And basically, as you read the language, every marijuana product, whether you're talking edibles, whether you're talking any kind of oils, whether you're talking any kind of marijuana smoked or eaten, or whatever kind of marijuana, including the manufacturing, including the growing, everything is controlled by these 10 people. They make all the profits. They make all the money. There is an Ohio Cannabis Commission that they want to come up with, but a lot of the rules would be written into the Constitution already. And, it basically is they get all the money, and it would be a huge amount of money that they're talking about. So basically, public health be damned, and we're going to they're going to basically sell out for on the backs of folks that are the most vulnerable. Doesn't sound like a real nice organization to me. However, the language we will post on our website tomorrow when I am back, and everybody can see it. I know that some folks have already gotten media requests and those types of things. If you have any questions about that, you can call me or Marcy, and we can help you get through that piece as well. I know Mary Haig did an interview last night. We did some interviews. So Mary Haig's article turned out very, very well. And in fact, it was interesting because one person who sounded like a pro-pop person for medicinal purposes actually said, you know, this is ridiculous. Basically, corporate America is, you know, is taking over the industry, and he doesn't like that at all. So do I think it'll pass? I don't know. Do I think it'll be on the ballot? As much money as they have, I'm hedging my bets that yes, they will. The next page is basically the initiative listed out the 10 different locations, including exactly where they are as far as the tax parcel numbers and those types of things, except in Summit County, in detail. So, you know, if you live in Butler County, you will have 40 acres, a little over 40 acres, that will be designated to grow pot. We have no idea how this is going to be secured. We have no idea how this is, because I looked up, since I'm in Stark County today, I actually looked at Stark County's tax parcel number, and right now it's a woods. It says according to the auditor's website up in Stark County. So I don't know how this is, you know, is there going to be armed guards? How are you going to get people not to come in? And this is a high crime area in regards to places in like California and Colorado. I mean, you have shootings and robberies and all of these other things. And you know, it just is, I wouldn't want to be a neighbor. And that's just the crime. You know, now you're talking the stench of marijuana. You're talking all of these different things that they have. So, you know, it's going to be interesting because there's nothing in the language about how this is going to be secured or anything like that. But Butler County has about 40 acres. Claremont County has about 13 acres. Franklin County, I have no idea where you're going to put that in Franklin County. It's all city. Has 19 acres. Hamilton County, again, you know, it's a lot of Hamilton County is the city of Cincinnati. About 24 acres. Licking County, about 35 acres. Lorain County is the largest. They have about 76 acres that would be used in a couple different parcels. Lucas County, which is, again, city of Toledo, 28 acres. Montgomery County, city of Dayton, 50 acres. Stark County has 27 acres. And Summit County has 29 acres that they would be used to grow marijuana. These are all grow sites. In addition, there are 5 testing facilities, you know, and those are Wood County, Lorain County, I think Mahoning County, Scioto County, and then one more, maybe Franklin County. But I know that these are what has been released right now. Again, we go back to the same questions that we have on everything else. You know, what's going to happen with you know, with public safety, worker safety? There is that you're not allowed to operate a car, a truck, a vehicle. However, there's nothing in it that defines what impairment is. Basically, it's left up to General Assembly what impairment means and what those penalties are. What, as far as trying to protect your business as a workplace, as an employer, you know, what are those? What can you do? Especially as it gets into, this is not only legalization for recreational purposes, it's also a medicinal initiative. So what happens is you have the whole recreational, anybody over 21, however, can get it. However, if you have a medical card, and there really isn't anything listed out as far as if there are medical cards or anything like that, but how does that work? And you get special privileges then. Yeah, it's just a total mess. So I don't know. I know we've got a couple minutes left in the webinar. I didn't know if we had any questions or anything.
We don't have any questions that have popped up thus far, but if you do have a question, please ask it in the questions section of the GoToWebinar navigation panel. And Tony, was there anything else that you want to add from what we're doing from our end to kind of contact our legislators and reach out from a legislative process?
Yeah. What we're doing is, as far as we have March 4th, that is going to be legislative education day for SPECA members and for Youth Led Network members. And what we want folks to do is we want folks to talk about the importance of prevention in as they go to their legislators. Sign up with Emily. She's off this week, but she can. I think there's a registration piece on the website. But talk about the budget. How important has the prevention dollars been to you? What are those functions of prevention that you're really seeing some strides in your community? Also, marijuana legalization, the medical marijuana for the kids with the seizures. There's a terrific. I sent it out in the last week's legislative advocacy update. A nice CBD, which is the actual compound that helps these kids. There was a nice piece that SAM, Smart Approaches to Marijuana, which is Kevin Sabet's group, has done. It's all scientifically based, and it's a nice piece to help folks understand. I think we're going to actually send that to all of our legislators. Marcy doesn't know that yet, so if you see her, don't tell her. But that's my plan as we go into folks' office, to not only to meet with them in person, but also send that to them as an FYI, and hopefully give a better option and a more scientifically based option than Charlotte's Web, which is grown basically in a greenhouse in Colorado by 5 brothers. So March 4th, again, sign up for to speak. Work with your legislator down here at the State House. Emily will help you set up times and appointments and those types of things. And it should be a day that we really, really take seriously because there's a lot of issues that are impacting us, not just marijuana, but powdered alcohol. That can be a total mess, especially for our young people. What are those pieces with the naloxone, that we support? What are some of the concerns? So there's an awful lot of things that we do. The legislature's taking a look, and if they don't hear our voice, then what happens is they don't hear our voice, and we can't complain when they pass kind of a misguided law, and hurts our kids, hurts our communities in the ways that we see. So hopefully you can join us March 4th. If you have any questions, call me or Emily, and we will surely help you out there.
And we don't have any other questions right now, but before we go, could you talk a little bit about the difference between Responsible Ohio and Responsible Ohioans?
Yeah, there's 3 groups actually going on right now who are kind of in the let's legalize marijuana business. The Responsible Ohio is this one that will be in 2015. That's when they want to get on the ballot. It actually says on the website it will be on the ballot in 2015, so look out for it. And they have also said they will spend whatever it takes to get this thing passed in Ohio. Responsible Ohio is this group of 10 investors. There's a group called Responsible Ohioans, interestingly enough. They have a Facebook page, and they're kind kind of a more of a grassrootsy type of organization. Interestingly enough, Responsible Ohioans hate Responsible Ohio, so two legalization groups that don't like each other. And then there's another group called the Ohioans to End Prohibition, which is they would like to have it on the ballot in 2016, and they're kind of political folks from younger people from like Case Western and those places, and that neck of the woods up in northeast Ohio. So, we have three. The one, again, I'm worried about is Responsible Ohio. They got a lot of money, a boatload. So, but their amendment is so poorly written and such a clear and transparent piece that is just going to make rich people richer that I think we can get it defeated. And we have a nice group of folks who are going to take it up on the political angle. We will need support and contact from folks, in your communities who might want to donate to that political campaign, especially businesses, to make sure that businesses don't have to deal with this in the state of Ohio.
Thank you. And we still don't have any other questions. So again, if you have anything that pops into your head, or as you hear the radio and other news outlets and these conversations pop up, and as you get requests, and we ask that you go to the marijuana resources page that we have on our Drug Free Action Alliance website, or feel free to contact Tony here at Drug Free Action Alliance at 614-9985, extension 17. And Tony, was there anything else you want to mention before we go?
No, I think that is good. I hope to see you all at the next the big day down at the State House and off the Maps. I think it's really, really important that we all galvanize. This is our time. Let's not take it lightly. Thanks so much.
Okay. Thank you all for joining us today. And again, if you have questions, feel free to reach out to Tony. Have a great afternoon, everyone. Bye-bye.